Hello friend, welcome to the channel Pharmacy Dictionary. We have studied about the absorption of drug via oral route of drug administration. Now it's time to understand the absorption of drug with the help of parenteral route of drug administration. What is the meaning of parenteral? We should know first because I have slightly changed the meaning of parenteral here. In the respect of parenteral, that is made of two words, para plus enteral. That means beyond the enteral route. And in case of oral route, that drug goes through intestine, that means enteral. But in this case of today's whiteboard presentation, all those drugs will bypass the oral route. That may be either subtopical, that may be either topical, sublingual, parenteral, IV, etc., but not oral route of drug administration. Along with this parenteral route of drug administration, we will also see the importance of bioavailability. So many other factors are also there which may affect the rate of bioavailability. So in this whiteboard section, we will conclude bioavailability too. So let's start the topic with the help of parenteral route absorption. See, in case of oral route of drug administration, we have seen the process that's called first pass metabolism. In that case, maximum portion of the drug get deactivated or denatured with the help of first pass metabolism. But in case of parenteral, it may be either topical or sublingual or buccal, or it may be either IV, IM, that the drug does not go to the first pass metabolism. They will bypass the first pass metabolism. So this is very important point. If we give the drug via intravenous route of drug administration, the drug will directly reach to the circulation and there will be no any phenomena called first pass metabolism, and the 100% absorption of the drug will be take place, and the 100% pharmacological effect of the particular drug which has been given by intravenous route can be achieved by the patient who has taken this kind of drug. But in case of intramuscular, there are some limitation or there are some governing factor. These are drug molecule dissolved in the membrane or tissue fluid and then that will be absorbed. To absorb the drug via intramuscular route, the drug should first absorb in the tissue or in the muscle, then only they will reach to the systemic circulation for their absorption point of view. And there are few cases. In case of intramuscular, this says muscle has rich blood supply, so the absorption is fast. In case of muscles, as you have seen the deltoid muscle in your back, in your arm, the muscle has rich in the blood supply. All body's part is having different circulation system, circuit system for the blood, but in case of muscle, they are rich in this kind of blood supply. So what happened according to this blood supply? If the blood supply is maximum at that portion, drug molecule will diffuse through the capillary membrane and then they will reach to the circulation. What is the meaning of that diffusion? I have placed a hash mark over here. That means whenever we apply any drug via intramuscular route of drug administration, the drug will be in higher concentration at the site of injection, but soon after some time the drug will start to diffuse along with the concentration gradient and that will reach to the capillary, and from the capillary that will reach to the final circulation. Like in case of river, there's so many water coming from the river, at least at last of the any other process they will reach to the sea and the sea reach to the ocean. Such like activity is going here, capillary, then blood circulation, and then finally its pharmacological effect. But now there is a condition in this case of intramuscular route of drug administration that lipid soluble drug absorb faster. So in case of intramuscular route of drug administration, for their absorption, the drug property should be lipophilic, lipid soluble. Coming to the next one, from subcutaneous route of drug administration, this is slower, but the rate of absorption is steady. That means it is slower as compared to intramuscular and as compared to the intravenous, but the rate of absorption is constant. The rate of absorption is steady state that can be assured that you will get proper amount of drug in a particular time of interval. So these are the basic point. Now we have to talk about the inhaled drug. Those drugs which are taken through inhalation route, that is very important because rapidly absorbed from the pulmonary epithelium, particularly the lipid soluble drug. In case of inhalation, what is happening here? Someone is inhaling any drug, that should be either lipid soluble, that should be in a volatile form, so that drug goes through the respiration and directly reach to the lungs, and there are so many pulmonary cells inside this lung and they get absorbed. Because of the help of pulmonary, or we can say alveoli, the drug will reach to the systemic circulation at a very faster rate as compared to the another route of drug administration. I have explained you what is the meaning of this parenteral. parenteral apart from intestinal route. So in apart from intestinal route, all this route can be concluded, and the reference for this meaning of parenteral is Padmaja Uday Kumar. So coming to the next point, that is topical route of drug administration. Whenever we apply any drug with the help of topical route, the drug should be highly lipid soluble, then only they will be absorbed from the intact skin. Suppose I have to apply some ointment or cream, that should be lipid soluble for their therapeutic point of view, for their internal absorption point of view, not for superficial phenomena. But this is very important point regarding the topical route of application. Now the example of those drugs which are given through the topical route are the nitroglycerin, but the absorption is relatively slow. This is important. The highly lipid soluble drug moves through the skin, intact skin, but the rate of absorption is not faster as compared to the previous one. That is a slower one, because of multiple layer present in the skin or the cell that may act as a barrier or hurdle for the movement of drug molecule across the topical tissues. So these were some points which affect the absorption of drug apart from the oral route of drug administration. Now we have to focus today's topic on bioavailability. This is a main point actually. This were the introduction so that you may understand the point of bioavailability in a comparatively way. What will happen if the drug is taken through oral route of drug administration, and what will happen with the drug if we take other than the oral route of drug administration, specifically from intravenous route of drug administration. We have to compare the advantage of these two routes with the help of bioavailability, and we will also see the different factors which may affect the bioavailability, because bioavailability is one of the most important phenomena for the action of any drug point of view. So let's start studying bioavailability in a next whiteboard section. Please be with us. In this section of whiteboard, we are going to study about the basic importance and parameter of bioavailability. This is not biopharmaceutics, so that we are not going to study the bioavailability, their determination method in much detail. This is just an introduction video, and after this video slide, we are going to study about the factor which may affect, which may alter the rate of bioavailability. So what is the meaning of bioavailability? As usual, we have to split the meaning of this bioavailability into two meaningful parts, that is bio plus availability. Bio means living organism, any organism who is having life, and availability means to make the available of particular thing. In Hindi it is called as a milna, us tak pahunchna. So what is the exact meaning of bioavailability? This is a standard definition. You should remember this definition as such. So the bioavailability is the rate and extent of absorption of any drug from its dosage form toward the systemic circulation is simply known as a bioavailability. Now let me clear this paragraph, let me clear this definition into simple language. We used to take different types of medicine that may be variable according to their dosage form, like solid, liquid, semi-solid, gases, or anything else. Such way their difference of route of administration can be also possible. So that depend upon the oral, sublingual, topical, buccal, vaginal, rectal, IV, IM, SC, IP, and there are so many other route of drug administration. So whatever the route of administration is, whatever the dosage form is, the ultimately aim of our drug therapy is to avail their therapeutic importance, to avail their pharmacological effect. So suppose I am taking any medicine like solid dosage form, like tablet or capsule, that will go through the esophageal route and finally reach to the small intestine. After disintegration, dissolution, the small intestine will absorb the active constituent of the drug, and that will transfer the drug towards the systemic circulation, that means blood circulation. Then only we will have their effect. So it is taking a good amount of time, but in case of IV, that means intravenous route of drug administration, we will simply inject the drug along with the help of syringe and needle, and the drug need not to go for disintegration, dissolution and absorption, because the drug is directly given in the bloodstream, and that drug will be fastly absorbed and will start producing its effect within a second, or we can say no in delay. So that is different between the action of oral route of drug administration and intravenous route or any other suitable parenteral route of drug administration. So the rate and extent, what is the meaning of the rate and extent in this definition? These are the soul of this definition. Rate means as proportional to the time limit. At proportion, that means what is the percentage of the drug in respect to time frame. That means how much drug in a particular minute, how much drug in a particular hour, or how much drug in a particular day. So that may be variable, but rate is specifically representing the corresponding or comparison in respect to time, and the second one is extent, that is amount, what amount of drug, how much time it taking to transfer of the active constituent from the dosage form towards the blood circulation so that may produce their action. That is called bioavailability. We have seen some basic parameter in absorption too. So bioavailability is one of the most important governing factor regarding its pharmacological effect. If the bioavailability is very good amount, then the drug will produce a desirable or somehow undesirable effect in a good amount of time, that will be very good for patient. But if the bioavailability of any drug is not appropriate just because of so many factors which we are going to study about the next slide, so that bioavailability will not be proper and the effect of drug will not be optimum too. So bioavailability is one of the most important factor. So if drug is not having proper bioavailability, we should try and we should work on that to how to improve the bioavailability of that particular drug so that their absorption, their pharmacological response may be achieved sooner. So this is the statistical definition of bioavailability. Now what is the formula, general formula of bioavailability? That is very simple. The bioavailability is equal to AUC of oral divided by AUC of intravenous divided by 100. Now what is the meaning of AUC here? I have given you the full form of AUC, that is area under curve. That means area which is falling or which is lying under any curve is called area under curve. This is called simply AUC. So AUC, that is area under curve for those drugs which have been taken by the oral route of drug administration, divided by the AUC, same for those drugs which are taken by the IV, divided by 100, and that is a percentage of that particular drug in respect of bioavailability. So why these two route of drug administration have been divided by each other? See, bioavailability of oral route of drug administration cannot be of 100% in any of the situation. Why? You have seen in just previous video that any drug which is going through oral route of drug administration will go for the first pass metabolism, and at the site of first pass metabolism, that is reverse, that is pre-systemic metabolism, we can also say, the drug, a portion of drug will be deactivated. So the drug will not produce 100% bioavailability in any of the situation, whereas in case of intravenous, the drug is directly moving through the bloodstream so that there is no chances of first pass metabolism, and that drug via IV route will produce 100% bioavailability. So we can calculate the percentage of bioavailability of any drug according to this formula, so exact bioavailability percentage will be obtained. Now this was the definition of bioavailability. Now we have to understand the basic graph of bioavailability. As I have said you earlier, this is not biopharmaceutics, so we are not going to detail in much detail about the bioavailability. Just basic and most important point will be covered here. So this is a graph. What is AUC? Area under curve. Now we have to plot the curve so that we can formulate that formula also. So this is the curve. This is the curve versus two parameter. The first one on x-axis, this is time. Main thing is time after the drug administration. Whenever you administer the drug of any route of drug administration, this is for common. This is not exclusive for oral. This is not exclusive for IV. This is a general graph of parameter of bioavailability. We will see the parameter of bioavailability of oral and IV later on. So this is general frame, or you can say skeletal of the bioavailability. So time after drug administration. Suppose we are taking drug through oral route like solid dosage form. So just after taking the drug, you can start measuring the level of drug irrespective of time. If you are taking the drug via IV or any other route, then you have to start the measuring of bioavailability just after taking the drug. On the y-axis, what is the parameter? That is PDC. What is the meaning of PDC? Here I have abbreviated this, that is plasma drug concentration. So after reaching the blood, through the blood, that drug will move to the plasma, that is the exotic component of the blood. So what is the concentration of the drug with respect to time which you have taken? Just for example, if you are going to measure the drug on each hour interval, so this is first hour, just for example, and this is second hour. So if you want to measure the bioavailability at particular after 1 hour interval, then you should take this after 1 hour. So that will be the concentration of the drug that reached to the plasma, and that is called plasma drug concentration. So in this graph we have few parameters. The first one is time, the second one is plasma drug concentration. Now in this graph there are three more parameters, like this first blue line. As you can see, this blue line, I have plotted this so that you may easily understand the concept. This blue line is representing minimum effective concentration. And what is the meaning of MEC, or the minimum effective concentration? The minimum concentration required of the drug to produce any of the effect is called minimum effective concentration. What is exactly meaning of this? Let me give an example from our daily life. Suppose I have a glass of water and I want to make this water sweet. So what I have to do, that I have to dissolve the sugar molecule on that water so that the water will convert it into a sweet water. For that, a glass of water, that means 250 ml of water, need at least, just for example, 2 to 3 tablespoons of the sugar so that that may produce sweetness. But sugar is important, but sugar is not that much important as the quantity of sugar. So what will happen if I will add just 2 to 3 pieces of sugar, granule sugar of granule? Will be that enough to produce sweetness? No, that is not required, that is not enough, that is not sufficient to produce sweetness. You are giving sugar, but that is not making water sweet. So you are giving drug, but the drug concentration is not enough to produce any kind of pharmacological effect. So there should be a minimum concentration that may produce, like 1 tablespoon of sugar, like same wise 500 mg of any drug, that is variable to drug, but the quantity of drug should be as much as possible that may produce desirable effect under the supervision of any guidelines of prescription drug, if you are talking about a prescription drug. So the first line is minimum effective concentration. The another one is green line, that's called therapeutic range. What is the therapeutic range? You will get it very soon. Let me skip this line first. Now next line is in red color. So obviously red indicate dangerous, green indicate good, and the blue is just a starting point. So the red one is explaining the MSC. Here it is MEC. Now here it is MSC. What is the full form of MSC? That is maximum safe concentration. The concentration, or we can say the maximum concentration of any particular drug which is safe. The drug concentration should not go higher from that particular range is called maximum safe concentration. 3 or 2 tablespoons of sugar is very much sufficient to make a glass of 250 ml of water sweet. But if you add 500 gram of particular sugar, then the sugar will make that water very sweet, and that is no use. That will be converted into syrup maybe, but that is not sweet water. So as like same, the drug should be in the same concentration that may produce effect by crossing this MEC, but that should not cross the line of MSC. So the drug should lies between MEC, that is minimum effective concentration, and between the MSC, that is maximum safe line, and that line, as you can see, is a green line. So in this green line is called therapeutic range. So any drug which is lying between these two parameters is considered as a safe or therapeutic dose of particular drug. So this is therapeutic range. Now coming to the other parameter, these are Emax. The point, I will explain you each graph you later. Emax, that means effect at a maximum level. So the point where the drug is producing its maximum effect is called maximum effective concentration. I have plotted two graphs, the red one and the blue one. I have left the green one, which I will going to explain you lively. So this is Emax. So what is Emax? A point where the concentration, or we can say where the bioavailability of any given drug is at its maximum level is called Emax. So same likewise, what is Tmax? It is touching to the plasma drug concentration, that is why it is Emax. This is the point of time, that is called Tmax, a time at which the bioavailability of any drug is at its maximum level or at its highest level. Let's call it Tmax. Now let me explain you the different types of graph I have plotted here. In this blue line, as you can see, the graph of any drug, we have three types of drug: blue, green, and the red one. So three drug I have taken to explain you the concept. First case is for blue line. This blue line is not able to cross the MEC, that means minimum effective concentration, and if the drug is not able to cross minimum effective concentration, how the drug will produce any kind of biological or intended or intentional or desirable action. So this drug will not be able to produce any of the effect. So that is not important for us. Whereas in case of Emax, as you can see, this line is obviously crossing the minimum effective concentration, so that will produce desirable effect. But apart from this MAC, it is also crossing the last safety line, that is MSC, maximum safe concentration. See, as you can see in this point, this is a portion where it is crossing the MSC, so it will produce desirable effect, but it will also produce undesirable effect, and that proportion may be uncertain, may be unchanged. What is the proportion of benefit and loss ratio? So it is not known to anyone except few drugs. So this is causing problem. Now what should we do that? Now coming to the third point, that is very important, which I have not plotted here. Now I am going to plot. This is dangerous, this is not effective. So what we can do, what should our objective is to be, that is a drug should cross this. See, this green line is crossing minimum effective concentration, and this is lying under the minimum effective concentration, that is not crossing the MSC. So this green line will be good to produce desirable effect, and that will not produce, it is not 100% sure, but it will not produce much amount of unwanted effect. So that drug which is having a green line will produce therapeutic range of any drug. This is important parameter. So there are two more points. We are giving any drug, so this drug is going to be dissolved in the blood slowly, it will take time. So here absorption is going to take place. So this phase is absorption phase. Absorption is taking place, but after some time that will produce effect. After some time, after producing the effect, it will start declining, because if you are taking any drug, that drug will not produce its effect throughout your life. It is having some duration of action. So after completing its specific duration of action, the drug will start following or excreting or eliminating their concentration. So the drug will now start eliminating or excreting from your body. So this is called elimination point. So I hope this parameter is clear for you. Now let me give you few more points regarding this bioavailability. The bioavailability of oral drug through IV, the bioavailability of drug through IV will be 100%. Two main thing, IV and 100%. These are direct relationship. If you are going to give any drug via IV route, that will produce 100% of its bioavailability. Now coming to the same point, the bioavailability of the drug which is taken through oral route will never be 100%. That will never produce bioavailability up to 100%. Now third one is, if you are giving any drug via intramuscular or subcutaneous route or sublingual route of drug administration, so the almost completely absorption will be take place, but the bioavailability will be more than 75%, but not exactly 100%. This point are very important, and the reference for today's point is Padmaja Uday Kumar. Now next point, transdermal bioavailability that may range from 80% to 100%, but this 100% having has mark, that is in only some cases, not for each and every kind of drug which are given through transdermal route of drug administration. So these were basic point. Now there are some abbreviated which I have explained already. AUC, that represent area under curve, and the PDC, that is plasma drug concentration. So this was basic plot of bioavailability regarding its few expression parameter. Now we should understand the basic factor which may affect or which may alter the bioavailability. So let's start the presentation point of view. That will be a PowerPoint presentation to explain the bioavailability factors.
Now we are going to study about the factor which can affect bioavailability. But before moving to that topic, we should revise the bioavailability, very short duration of time. The rate and extent of the drug absorbed from its dosage form is simply considered as a bioavailability. In this definition, the two words, the first one is rate and the other one is extent, are very important, because all bioavailability depends upon these two terms only. But another important point says systemic route is considered to be 100% bioavailable. That means any drug which is given through intravenous route of drug administration will produce 100% bioavailability, whereas any drug which is given through oral route of drug administration will not be produce any 100% response because of the first pass metabolism. So if we want to calculate the formula of bioavailability, we can consider or we can find out the bioavailability with the help of this formula that says bioavailability is equal to AUC, that is area under curve of orally administered drug, means that drug which is taken through the oral route of drug administration, divided by AUC, that is area under curve of those drugs which are taken through intravenous route of drug administration, and multiplied by 100. This is important. If you want to calculate the percentage, you should multiply it by 100. So this was basic introduction regarding bioavailability. You have seen this diagram in the whiteboard section. Let's consider another important point. As per the definition of bioavailability, AUC oral divided by AUC IV in 200 is called bioavailability. But in this graph, as you can see, there is a time respect and the plasma drug concentration on y-axis. So this is y-axis, this is x-axis for the calculation of bioavailability. These two terms are important because the respect of bioavailability is dependent on the rate and extent, as I have explained to you in the earlier slide. But here I am going to compare the two bioavailability of two respective route of drug administration, like intravenous route of drug administration with the comparison of oral route of drug administration. So let's consider oral route of drug administration first in the case of bioavailability curve. As you can see, this starts, that means movement of drug in our plasma starts from 0, and as per the respect of time, when time increases, the concentration of drug that is given through oral route will reach the serum concentration. So as per the time initiate, this graph, as you can see, this is a graph. So this graph is moving through. So this is the bioavailability graph for oral route of drug administration. You can see and you can compare the distance between starting point toward the Tmax point and Emax point. This is called Emax point, as I have explained you in the board, and this is called Tmax because this is the time at which a maximum bioavailability shown by the oral route of drug administration. But in case of intravenous, as you can see, this is a sharp peak of the drug, that is Tmax. Actually, this is the Tmax for the intravenous route of drug administration, and this is called Emax for the intravenous route of drug administration. As you can see, this is 100%, this one, but it is not 100% for the oral route of drug administration. So here in this graph, this is absorption phase for both IV and oral, and this is elimination phase for both IV and oral. So we can say this is the elimination phase of declining phase, and this line is minimum effective concentration, this line is maximum safe concentration, and the area between these two terms are called therapeutic range, so that we can consume the drug under the safety margin. So this were the graph of bioavailability. Now let's move to the main point, that is factors affecting bioavailability. Under the category of factor affecting bioavailability, we can classify all those factors into two main subtypes. The first one is pharmaceutical factor and the other one is pharmacological factor. Although both factors are important, but as per the previous discussion with the route of drug administration and the factor affecting absorption, we can give little bit weightage to the pharmaceutical factors. So these factors are, first one is particle size, salt form, crystal form, water of hydration, nature of excipient, degree of ionization, and formulation factor. But apart from this pharmaceutical factor, pharmacological factor are also important. These are gastric emptying and gastric motility, gastrointestinal disease, food and other substance, first pass metabolism, drug-drug interaction, pharmacogenetic factor, emotional factor, that is also known as a psychological factor. So all those factors are very important. We will concise all those factors in a short. So first start with the pharmaceutical factor. Those can affect bioavailability. The first one is particle size. Particle size is very important for the determination of bioavailability, as we can say the rate of absorption of drug can be affected by the particle size, because if the particle size are smaller, their dissolution will be faster, and if the dissolution is faster, their absorption will be faster, and that may affect bioavailability. So the particle size is very important phenomena. Lesser the particle size, larger the bioavailability graph, the bioavailability phenomena. So we can say the particle size is very important. Example are microfine aspirin, spironolactone, glycofulvin, and digoxin shows very fast absorption because of their particle size. Now next one is salt form. Salt form is important for their solubility point of view, and if the solubility is higher, definitely their absorption and further their bioavailability will be higher. So as you can see in the blue line, salt of weakly acid drug are water soluble, and those drugs which are water soluble will having a better absorption for respective point of view. So this is important point. Sodium tolbutamide and sodium secobarbital have better bioavailability than tolbutamide and secobarbital, just because of their salt formation or salt form. So in many of the cases we have seen that in a drug, the last So the next point is crystal form. The absorption rate and bioavailability of any drug depends on its crystal form also. Mostly amorphous drugs are more soluble than the crystal form. This is important line. You should remember it because the amorphous form required less energy to break down, whereas the crystalline form required higher energy to be getting break down. That is why their rate of absorption and dissolution is faster for amorphous drug. Example are amorphous chloramphenicol, palmitate and amorphous novovicon have faster dissolution rate as compared to the another crystalline form. This is important parameter. Now coming to the next one, that is water of hydration. That means many drug can associate with the water to produce crystalline form and called hydrate. So if the drug are interacting with water to produce crystalline form, they will require more energy to be dissoluted, so that may affect the bioavailability. That is why anhydrous form of caffeine, theophylline and ampicillin have faster dissolution rate and better bioavailability as compared to the hydrous form, because they are not forming crystal formation. Now next one is nature of excipient. These are very important parameter. So we have to use so many additive or excipient while formulating any tablet or any other dosage form. But in case of tablets, there are much amount of additive like lactose, calcium sulfate, guar gum, gum acacia, tragacan, etc. If you increase the percentage or quantity of binding agent like guar gum, gum acacia, they may become hard, and the harder the tablet will reduce the dissolution rate, reduce the absorption, and finally they will reduce their bioavailability. So if you have to increase the bioavailability, you should prepare your dosage form accordingly. No need to add extra amount of additive or extra amount of binding agent. This is very important. Now next one is degree of ionization. We know it very well that non-ionized lipid soluble drug are better absorbed, whereas the strongly acidic and basic drug and highly ionized drug are reduced bioavailability. So it is very important for the drug that they should be in unionized or non-ionized form for their better absorption. Example are streptomycin, sulfaguanine, neostigmine and D-tuberculin are better absorbed because of their unionized form. Now coming to the pharmacological factor which may affect bioavailability. These are gastric emptying and motility. If the gastric emptying is fast, then the absorption will be fast because the drug will reach to the stomach very fast, and from that stomach they will reach to the intestine also in a rapid movement. So the absorption will be fast. But if the gastric motility is very rapid, that means if you are taking the drug and the drug is getting eliminated very rapidly from your rectal route, so the absorption time will be lesser and the absorption will be slow, and if the absorption is slow, their bioavailability also be little bit as compared to the different cases. So it is very important that we should maintain a proper gut motility so that a proper amount of drug will be absorbed. Example, gastric emptying is promoted by fasting. If you are in a fasting kit, that may promote the gastric emptying. Anxiety, lying on right side and hyperthyroidism can increase the gastric emptying time. Now coming to the next point, that is gastric disease. If you are having any kind of problem listed below, then it may affect bioavailability. If you are having achlorhydria, gastric acid secretion is decreased in this case of gastric pH, so that dissolution of the particular drug will be hampered and the absorption will be inhibited. And if the absorption will be inhibited, the bioavailability will also be hindered. Now coming to the next point, that is food and other substance. As I have explained, in the case of factor affecting absorption, almost all points are same. If you have taken any heavy food containing different types of juices, that may affect the food. If in case of milk, the milk may also precipitate some drug. So accordingly, it is not same for all kind of drug, that is drug specific. Few foods may increase the absorption of drug from the intestine, but few food may affect the absorption of drug just because of their interaction. That's called drug food interaction, or vice versa, food drug interaction. So these are important points. Next one is first pass effect or first pass metabolism. As you know it very well, that if the drug is getting metabolized before reaching to systemic circulation, that is called first pass metabolism, or we can also call it pre-systemic metabolism. In this case, it is applicable with the oral route of drug administration only. Only those drugs which are given through oral route can be affected by the first pass metabolism. So this first pass metabolism reduce the absorption, and this absorption may reduce the bioavailability if it is taken through oral route of drug administration. administration. There are so many examples which you can download from the description box. I am not going to explain in much detail. Next point is drug-drug interaction. This is very important point. We have included a video regarding GPAT preparation in our main channel, that is Solution Pharmacy, regarding drug and NSAID interaction. Drug-drug interaction is a phenomena where one drug is interacted with the another one. If you have taken two or more than two drugs simultaneously, so one drug may affect the absorption of another drug. They may facilitate or they may hinder the absorption of each other. So these are drug specific. Which drug affect the another one, we have to memorize it. Now next and the last one is other factor, like route of drug administration. If you are giving any drug via oral route of drug administration, their bioavailability will never be going to be 100%. But in case of IV, that is equal to, but in case of IV, that is considered to be 100%. So I have explained you regarding other point, area of absorption surface. If the absorption surface is very good enough, that will be absorbed by the surface and the bioavailability will be higher. State of circulation of blood to the site of administration is another important point. If the blood is highly circulated to the area where you have applied the medicine, so the drug will absorb by that kind of circulating blood. But if the drug is not absorbable enough because of lack of blood supply, the bioavailability will be reduced. So friend, this was the rapid revision of those factors which can affect the bioavailability. You can download the PDF of bioavailability in detail by checking the description box of the same video and by clicking the respective unit notes. Thank you very much for watching this video. Namaskar, take care.